Hello, everyone. My name is Rohan Chopra, and I am a research intern at the Trauma Imaging Research and Innovation Center at the Brigham and Women's Hospital, and an undergraduate student at Northeastern University in Boston. Today, I am grateful for the opportunity to share an overview of our study on analyzing the prevalence of injury and violence in transgender patients using radiology reports. Transgender individuals, especially transgender women, are known to experience disproportionately high rates of violence. In addition to intimate partner violence, or IPV, they often face various other forms of interpersonal violence, including discrimination, hate crimes, psychological abuse, and social isolation. Furthermore, when transgender individuals seek help, they frequently encounter additional discrimination from shelters, from law enforcement, and from healthcare providers. These barriers perpetuate severe health disparities and can increase reliance on violent partners, making it more challenging for individuals to escape a cycle of unaddressed and escalating violence. Given the high prevalence of violence and significant underreporting among transgender and gender diverse individuals, the purpose of our study was to make the invisible visible by comparing injuries between transgender and cisgender women using radiology reports. We use our institution's research patient data registry to create a cohort of 263 transgender women and rigorously match them with 525 cisgender women based on age, race, and ethnicity, minimizing potential confounding effects. By examining these groups, we aim to identify and compare patterns in injuries and imaging utilization between transgender and cisgender patients. To analyze these patterns, we calculated adjusted incidence rate ratios and odds ratios, which provided a meaningful way to quantify differences in injuries and imaging rates. Our findings reveal a stark contrast in injury patterns, with transgender women experiencing significantly higher injury rates than their cisgender counterparts. Specifically, injury rates for transgender women were 3 times higher overall, with transgender women suffering 8 times as many head injuries, 36 times as many facial injuries, and 5 times as many chest injuries compared to cisgender women. Additionally, transgender women with radiologically evident injuries were 4 times more likely to report experiencing IPV than cisgender women with similar injuries. On a positive note, however, radiologists demonstrated a positive predictive value of 67% in identifying violence when they suspected IPV among transgender female patients. Our findings indicate not only an elevated risk of violence for transgender women, but also significant gaps in their preventative care. By recognizing specific imaging patterns, radiologists can help identify at-risk patients, facilitating timely IPV screening and support for this vulnerable population. Thank you for your time, and I look forward to presenting our findings at RSNA 2024 on December 4th at 9:30 a.m. Thank you.